Hi, I'm Richard Knacht, Integrated Services Advisor with the Department of Social Services, working with the department and its many partners to implement CCR and KDA reform efforts. One of the tools that the department has recently produced in support of CCR is the Integrated Core Practice Model Guide, released jointly on May 18th of this year. The ICPM is the second iteration of the Pathways to Wellbeing practice model, which was released some years ago as part of the KDA settlement. This 2018 version is an enhanced rendition building on the California Welfare Directors Association design team work and with input from the California Behavioral Health Directors Association experts and the Chief Probation Officers of California. We believe this guide is the first multiple agency core practice model in use anywhere in the country and captures the effective and essential principles and practices for child welfare, behavioral health, and probation professionals. I'd like to introduce you in the next 6 minutes to one of the ICPM's core elements, the way we plan for and execute transition and care coordination services. This short primer video is intended to support the work of social work and probation case managers, ICC care coordinators, or any professional staff who have responsibilities for coordinating and transitioning services. If you attend child and family team meetings, this primer may be of interest to you. The ICPM includes strategic and practical frameworks in support of key service processes that are proven effective with youth and families. Transitions, the subject of this short video, is one of 4 domains or areas of focus: engagement and assessment, service planning and delivery, and monitoring and adapting are the others. While there are many definitions of care management, here's a partial definition that highlights some key processes and purposes to effective case coordination. Note that the essential objective of care coordination is to ensure that care from disparate providers is not delivered in silos. Given the high needs of most foster youth for mental health, special education, or other services, this need for highly collaborative care is paramount for our youth. More specifically, because as a service industry we've struggled a great deal in this area, let's define a transition as it applies to our foster youth. Transitions can involve placement into a new STRTP or foster home, assignment to a new staff member or therapist, or any other change in the location of or the personnel involved in delivering whatever service you might be responsible for. Transitions are the critical times when many youth fall through the gaps in our care continuum, and it's why the ICPM has an entire section devoted to transition supportive behaviors and principles. Effective and thoughtful transitions are critical for foster youth because at least half of our youth need some form of behavioral health, substance abuse disorder service, or other specialty intervention. Additionally, more than 1 in 4 of our foster youth in California will likely get care in a second county at some point. County-to-county movement is among the most challenging for our systems to manage, and particular attention and much follow-through is needed when a youth moves across county lines. Our partners at the Department of Healthcare Services, in their role as administrative service entity for specialty mental health services in California, has provided guidance in this area. In addition to this reference from the Medi-Cal Documentation and Billing Guide, the state's practice guidelines require any youth in STRTP level care to have a transition plan in place before the discharge actually occurs. The plan should clearly call out how, who, and when transitional supports and steps will be delivered. Planning for transitions includes a discussion about what resources will be needed for purposeful transition out of formal services. This might include a potential mix of natural and organic supports in the community. Effective transitions are begun at or before a youth is accepted into a care setting and begins in earnest at the initial child and family team meeting. Professionals responsible for care coordination and transition services must maintain responsibility for and contact with youth and family at the time of discharge or movement until new service delivery professionals are in place. If a client is not verifiably in service in a new setting, the existing case management relationship should never be terminated. The ICPM contains specific language around transition practice behaviors. Good transitional care services should always seek to ensure that a family and youth are fully and deeply engaged with natural, community, and organic supports. Connecting to natural supports, while not sufficient in most cases as a discharge plan, will often be key to their long-term outcomes. Here are some useful questions that care coordinators can ask of themselves and their partners. This list is intended to be thought-provoking and, of course, the most important question: has the young person begun receiving all needed services with the new service provider or responsible care coordination party? If that answer is no, then prior or existing teams must remain involved and invested. Ineffective transitions have many costs, not the least of which is the high potential to re-traumatize youth and family. While poor transitional care disrupts the youth's life, there are systemic and organizational costs as well, including more time solving crises, more inpatient days, lost school days, and higher costs to systems overall. Alternatively, good transition and care coordination has system advantages. Counties will typically see reduced crises, less time coordinating care in challenging cases, and fewer flight or other risky behaviors. And remember, these outcomes mean greater job satisfaction for us as professionals. Investing in highly responsible and focused care and transition services will translate to happier professionals. To wind up this very brief primer on transitions, remember that DHCS and CDSS have guidance and expectations for transitional care that are found in Welfare Institutions Code and other related guidance. Good transitions take time and energy, but they pay off for clients, families, and for professionals. Finally, we should acknowledge that no rule or law by itself will result in good transitional care. Each of us, as care managers, case managers, or care coordinators, must assume responsibility for keeping our youth connected to appropriate services during transitional periods. We hope to visit with you soon about the first element of the ICPM, engagement. Until then, happy and successful transitioning.